I'm the Chief Medical Officer at OMSignal, and I'm also an orthopedic surgeon doing sports medicine. In my medical life, I'm really focused on taking people from a trauma where they're injured to get them back to sort of performance enough to get back to their daily living. But I think that then medicine falls down a bit. So I joined OMSignal in part because I'm interested in getting people back to their peak and maybe even achieving a higher peak. And the gold standard is really a randomized controlled trial. And that's where we ask patients to consent to either get treatment A or treatment B, not knowing what they're going to get. It's really hard in surgery because sometimes it means even no surgery or surgery. And the problem with that is that we get patients to trust us to do that. We do it for the best of intentions to try to figure out what the best treatment for them is, but we never actually give them their data back. We tell them what the results of the study were, but we don't really get in touch with them and say, well, this is what your data was in comparison to everybody else's. And I think that's where wearables can democratize the data that's collected in healthcare and really help people to start understanding a bit more about how they personally fit into the results of a study or fit into their doctor's recommendations. This is the idea of precision medicine, and it's really where we need to go, because a randomized controlled trial, it's kind of telling you what's best for the average person, and nobody's the average person. This is going to, I think, drive hospitals, drive research institutes to care more about big data, to understand how all the data that we're collecting can lead to insights about healthcare, about making healthcare more efficient. And I think that that's going to create jobs in data analytics and in machine learning within the medical profession, which just don't exist right now. It's still kind of a niche field. And I wonder if it's going to be the death of the randomized controlled trial and the death of evidence-based medicine, because I see that as a very inefficient way to come up with answers for patients. When I was starting to get interested in wearable devices in terms of measuring outcomes, particularly of shoulder pain and sleep, I never expected that I would end up being the chief medical officer of a wearable tech startup. And it's been a crazy experience to kind of ride the wave of this revolution and try to see what's going to stick and what isn't. The ultimate wearable is clothing, because we all wear it every day. We don't all wear wristbands or watches. Like, I'm not wearing one right now. And what we do all wear is clothing every day. And so when we get to a point of the clothing being the wearable, which OMSignal is doing, and when it becomes ubiquitous in our clothing, then the data streams become ubiquitous, and suddenly we have this opportunity to really impact people's health, population health, and make data-driven decisions in medicine.